Let's see an NCLEX RN video based on assessment of auditory function. The nurse is developing a teaching plan for a patient undergoing ENG testing. Which instruction will the nurse include in the pre-test teaching plan? Remain NPO for at least 12 hours prior to the test. Do not bring eyeglasses to this test. Narcotics will be introduced approximately 1 hour prior to testing. Patients with pacemakers should not have this test done. ENG is electronystagmography, which is a test which is done to detect both central and peripheral diseases of the vestibular system. So for this patient, the nurse need to include the patients with pacemakers should not have this test done because pacemaker signals can interfere with the sensitivity of the test and provide a false result. The nurse notes in the patient's chart a diagnosis of presbycusis and correlates this condition to which physiological change. Nystagmus that is expected with aging, sensorineural hearing loss that occurs with aging, conductive hearing loss that occurs with aging, changes of the eye related to the auditory system. Presbycusis is hearing loss that is related to aging that is considered sensorineural in origin. The nurse is performing an otoscopic examination on a patient as part of a routine physical examination. What finding is consistent with a normal tympanic membrane? A pink colored tympanic membrane, a pearly gray colored tympanic membrane, a red dull thick membrane if the patient is over age 20, a shiny creamy colored membrane. The expected finding for the tympanic membrane is that it is pearly gray colored without any thickness or exudate. Which medication does the nurse administer with caution in a patient at risk for hearing disorders? Acetaminophen for pain relief, furosemide for diuretic defect, phenylephrine for allergic reaction, diphenhydramine for the treatment of a rash. So the medication is furosemide for diuretic effect. Furosemide is a well-known drug that can cause hearing loss in patients. Which action demonstrates proper technique by the nurse in the performance of an otoscopic examination on a 47-year-old patient? Pulling the pinna up and back, pulling the pinna down, using a pediatric size speculum if the patient is less than 63 inches tall, moving the patient's head toward the practitioner just prior to the insertion of the otoscope. So here the patient is 47-year-old. Pulling the pinna up and back is the best way to straighten the ear canal, providing the best visualization for the practitioner. The nurse correlates which anatomical structure as the location of the sensory organs for hearing and equilibrium. Eustachian tube, ossicles, bony labyrinth, tympanic membrane. The bony labyrinth is the structure that holds the sensory organs for equilibrium and hearing. The eustachian tube connects the middle ear to the nasopharynx and assist in stabilization of air pressure. The ossicles assist in transmission of sound vibration, and tympanic membrane separates the external and middle ear structures. The nurse recognizes which actions as essential functions of the auditory system. Transfer of sound waves through the auditory canal, vibration of the eardrum, warming air as it enters the outer ear, balance, secretion of cerumen. So, the essential functions of the auditory system: transfer of sound, vibration of eardrum, maintaining balance, and secretion of cerumen. So, transfer of sound waves through auditory canal, vibration of the eardrum, balance, and secretion of cerumen. Warming the air is not a function. When the nurse assesses a patient regarding the auditory system, which is the most important question to ask? Do you have any chronic illness that require you to take daily medication? Have you ever been told that you are tone deaf? Did you ever have a foreign body in your ear? Do you notice that you have wax in your ears? Chronic diseases and medications can have a strong effect on the patient's ability to hear. Therefore, it is essential to take a thorough history, which is the most common examination used to assess a patient's auditory function. Examination using the tuning fork, assessment of all the cranial nerves, examination using the otoscope, evaluation of a written questionnaire. Examination with an otoscope provides essential information to the practitioner about the internal structures of the ear that play an important part in the patient's ability to hear. The nurse implements which actions prior to the patient undergoing diagnostic studies of the ear? Verify the patient's understanding of the scheduled test, request that the nurse technician obtain consent for the test, reassure the patient that the ordered test should be completed, inform the patient that teaching for this procedure is the provider's responsibility. Prior to undergoing any diagnostic studies, it's important that the patient understands what is being done to decrease the fear and anxiety and to increase the cooperation with the test. The nurse recognizes which medication as ototoxic. Non-salicylate pain medication, calcium channel blockers, antibiotics such as gentamicin, beta blockers. Gentamicin, it is a well-known caustic medication that causes or produces negative effects on patients' ability to hear. The nurse should instruct the patient to perform which action to prevent possible ear trauma. Whisper when possible to prevent ear strain. Select earbuds for electronic devices over external earphones. Be cautious when taking oral medications. Never use a cotton swab or other similar instrument in an attempt to remove wax. A patient who is inserting a cotton swab or other similar instrument can cause perforation to the eardrum or move or impact the cerumen in the ear canal, causing the loss of hearing and possible infection. Which findings are expected age-related changes in the auditory system? Increase in frequency of ear infection, hearing acuity may decrease, the ability to hear high frequencies is lost first, the tympanic membrane loses elasticity, increased flexibility of the stapes. Increase in infection frequency and increased flexibility of the stapes are not expected changes with the auditory system as a patient advances in age. So, hearing acuity may decrease, the ability to hear high frequency is lost first, and tympanic membrane loses elasticity are expected changes. So this is a case in which Erin, a 52-year-old waitress, plans to see her provider for a physical examination. She has always enjoyed excellent health, though she did experience numerous ear infections as a child, requiring surgical insertion of pressure equalizing tubes. So these pressure equalizing tubes are tiny tubes surgically inserted in the tympanic membrane to equalize the pressure and prevent infectious buildup. Currently, Erin has no known chronic disease and takes no medication on a daily basis. She has been noticing waxy buildup in her ear canal lately, which she has treated herself using a cotton swab to remove the wax. Erin has not noticed any hearing changes and plans to discuss the recent waxy buildup in her ears with her provider. Erin provides a detailed history, family and health medication history to the nurse provider. Physical examination and simple hearing assessments are noted as normal by the advanced practice nurse and yields no concern to To complete the examination, the advanced practice nurse removes the earwax to increase the visualization. Erin notices an immediate improvement in her hearing ability after the wax is removed. The provider notes the opportunity for teaching regarding Erin's use of cotton swabs to clean the earwax from her ears. Concern is raised regarding the possibility of introducing trauma to the eardrum or other internal ear structures by use of this foreign object. Erin states that this is the way everyone in her family cleans up his or her ears, and so she has performed this action for as long as she can recall. The provider concludes Erin's examination with teaching of ear hygiene without the use of introducing objects into the ear canal, thereby possibly preventing trauma or hearing loss to her. The nurse recognizes that ear infections are more common in children, for which reason? The immaturity of the hair cells within the ear canal, the increase in wax production in children younger than 5 years, the flat position of the eustachian tube, the immaturity of the immune system. In children, this eustachian tube is more flat in appearance, thereby allowing the fluids to collect and stagnate, increasing the chance of infection. So the flat position of eustachian tube is the major reason for ear infection. What teaching is most important for the provider to provide to Erin during this visit? Not using cotton swabs or other similar instruments in the ear canal, ways to remove the waxy buildup from the ear canal, what to do if the patient starts to notice hearing loss, use of earbuds for listening to music. So here, use of cotton swabs or other similar instruments can create a rupture or impact the cerumen in the ear canal. So not using the cotton swabs or other similar instruments in the ear canal is the teaching. The healthcare provider instructs the patient on which ear protective measures. Earbuds to reduce noise in areas with high decibel noise levels. Earbuds to help prevent water from entering the ear canal. Headphones to listen to music at medium to high decibel ranges. Earplugs to help decrease water from entering the canal while swimming. Wearing earmuffs in the winter. So, earplugs to help decrease the water from entering the canal while swimming. Erin does not notice any hearing changes. The provider verifies Erin's ability to hear by using which test? An MRI for the most definitive testing, audioscopy, a CT scan of the head, electronystagmography. So, audioscopy, this handheld portable test allows the provider to assess the patient's ability to hear general tones. Erin's ability to hear better after her physical examination is directly related to which action? The removal of the embedded wax from the ear canal, the examination with an otoscope. It's not clear why Erin is hearing more clearly. The stretching of the ear canal while an otoscopic examination is completed. So here, the removal of the earwax can improve the hearing, as impacted wax can form an obstruction, thereby decreasing the ability of sound waves to transmit. Hope you understood this video. Thank you so much for watching. Have a good day.